Hi, everyone, and welcome to today's webinar. I'm Laura Pata, Director of Customer Success here at Infinix, and we'll be moderating our discussions today. Our topic today is optimizing your orthopedic practice's patient access workflow using augmented intelligence. If you have any questions during the presentation, just write them in the chat box and we will review them at the end of the presentation. Before we get started, I'd like to introduce you to our presenter today, Jeff Davis. Jeff leads new business development and strategic positioning opportunities for Infinix in the central and western state regions. He's been with us for the past 2 years and has deep healthcare revenue cycle expertise in developing and implementing client-focused solutions for healthcare executives. For the past 23 years, he has held new business development positions within the healthcare technology and revenue cycle verticals. So with that introduction, I'd like to hand it over to you, Jeff.
Hi, welcome everybody, and thank you for joining. Appreciate your time, and hopefully today you'll learn a little bit about our company, what we do, how we do it, and if it happens to be something you have a deep interest in, we'd love to have a chance to discuss with you further. But as Laura said, if you have any questions, put them in the chat box. We'll address those as they come, and we'll actually pause near the end and take some Q&A as well. So we'll go ahead and jump in. Now, a little bit about us. Our company is headquartered in San Jose, California, and this particular company was founded in 2012 as a revenue cycle management company. We cut our teeth in radiology with RadNet, the biggest provider of imaging services in the U.S. We provide rev cycle for both their east and west regions. But since then, we branched out into other specialties, cardiology, orthopedics, pathology, and so forth. Orthopedics makes up about 30% of everything we do. So we do have deep domain knowledge and expertise in orthopedics and a number of orthopedic clients. You see some of them there in a marquee clients list down below. So about 5-6 years ago, we developed out some technologies. So we're not just a rev cycle management company, but a tech company as well. And I mentioned rev cycle simply because there are some tech companies out there that jumped into healthcare after the fact and don't really understand the business of healthcare. So our company actually does understand the business of healthcare, since that's one of the main things we do. We've got about 2,500 employees globally, offices in Houston and in Austin, where the bulk of our revenue cycle service lines are out of. And that said, I'll go ahead and jump in to the rest of our presentation. You see some of our other services there on the right-hand side of this payment life cycle. Coding, we provide interim coders, end-to-end billing operations, AR recovery, we do AR workdown projects, things like that. But we're here really to focus on the left-hand side of this healthcare payment life cycle. Beginning with insurance discovery, we also provide insurance verification, benefits eligibility, patient pay estimation. That's becoming a very large part of our business, actually, because it's become more and more of a requirement for our clients. And we'll also talk about prior authorization. In addition to that, we have a clinical decision support mechanism for those of you that might do in-house imaging. That directive has been pushed off until at least January 2023 and possibly further, but it is up in the air currently. So we'll leave the clinical decision support mechanism for another day, but we'll focus on really the first parts of this this payment life cycle on the patient access side. Okay. Some of the issues that we see that arise around both verification, eligibility, and prior authorizations. You see on the referral side, which we also provide support on. It's very heavy paper, a lot of faxing involved, and you end up missing auths for missed referrals as well. Eligibility and verification, patient information could be incomplete. Lack of verifications can cause issues. And the patient pay estimation, first of all, you have the transparency requirements now, but if you're not having the discussion with the patient on the front end as far as what their responsibility is going to be, you're missing out on a lot of revenue. The experts tell us that you miss out on as much as 30 to 40% in collectible revenue. So if you have that discussion with the patient on the front end for the patient pay estimation, you're able to improve your patient pay collection side by as much as 30, 40%. So we need to make sure we're doing that so we can address those issues. Then on the prior authorization side, you got all the burdens around the clinical reviews and the turnaround times. You can lose revenue as a result of denials and turnaround times. You have patients dropping out. They get tired of being rescheduled, for instance, when it comes to imaging and procedures sometimes. So we want to try to avoid those at all costs and help improve the patient experience, number one, and help improve the relationship with referring physicians as well. So if we can help get their patients turned around faster, then it keeps them happy, keeps the patients happy, and can in turn improve revenues on the top line. Then on the back end, you see the patient financial engagement side. You can have limited transparency on your out-of-pocket costs when it comes to all of these things. So that said, we'll go ahead and jump into the next slide. We have a case study here. One of our clients that we brought on a couple of years back out on the East Coast. They've got 70 providers, 11 locations. They had about a 10% denial rate due to missed authorizations, and not to mention write-offs and things like that. So they did have some additional revenue leak for write-offs. But you see, they had an overburdened patient access team, prior authorizations. That burden has really increased over the last 4 or 5 years. You see more and more FTEs on the patient access side just sitting on the phone on hold, and that's just not a good use of their time. And in this case, trying to schedule patients, they're having to schedule 21 days out, and that was just unacceptable. If you're in the 7-day range, that still can be quite a ways out. So our turnaround times, we are able to reduce those down to 24 to 48 hours in most cases. So getting the throughput is important. So the solution, our prior authorization solution is an artificial intelligence-driven prior auth. So we leverage it to determine whether or not an auth is required, and also to determine turnaround times and things like that on the front end. Now we do combine our solution with specialists that are trained in each medical specialty, including orthopedics, so that any exceptions are handled by our specialists. For instance, if we find a payer that does not accept electronic submission for prior authorizations, we have specialists that can take up the mantle and handle those manually. So we also integrate with multiple EMR, EHRs, risk platforms, scheduling platforms, a number of order entry platforms like ScriptSender and OpenDoctor. We're able to get the data seamlessly, but in this case, we integrated with their EMR systems, and we continuously improve those processes through artificial intelligence and machine learning capabilities. And then on the back end, we provided some real-time analytics and a reporting dashboard that I'll show you here in just a moment, in order to maintain full transparency and give some BI on the back end, so this organization could actually make some better business decisions in the long run. So the result of us combining our experience, not only in prior authorization, but also in rev cycle, the business of healthcare, if you will, combined with our technologies and our people, our specialists, we're able to take these challenges and turn the business around. And the result was we completed about 600 prior auth requests within the first 30 days of implementation, which is pretty good clip there. we saw a 50% decrease in denial rates. That's probably the most important metric because that's dollars. Every denial that you run across, if you resubmit those, you're looking at around $100 cost just to resubmit those. So that can be quite costly, in addition to those that end up getting written off. So the turnaround time decreased by 5 days, improving patient care and satisfaction. And anytime we can reduce those turnaround times, we see the throughput improve. So you can see more patients. For those of you that have in-house imaging, you see more throughput in your modality work list, so you don't have as many gaps on that side of the business, as well as being able to keep the surgical centers, keep those operating rooms full as well. So, and we ended up saving this particular group about $470,000 annually in administrative costs through FTE, being able to redeploy those FTEs doing more meaningful tasks, and again, reducing write-offs and reducing denials and things like that. So we ended up improving revenue just because of throughput, increasing their revenue by about $55,000 just in the first 90 days. And overall, significantly more. Okay. So to give you an idea of how our augmented intelligence, and we call it augmented intelligence rather than artificial intelligence, because we're really combining the know-how of our specialists with an artificial intelligence, a machine brain, if you will, combined with machine learning. And so this three-pronged attack, along with the automating our service lines, we're able to really improve throughput, improve the number of prior authorizations that we're able to attack on a daily basis. And it looks like we've got a question here, and let me pause just a moment here. And Jim says, was this account able to completely outsource prior authorizations? And the answer is yes. We actually have 100% coverage of all of their prior auth needs. So they were able to completely outsource their prior authorization. And to kind of follow up on what might be a second question that you might have, we also can provide support on clinical support, clinical documentation. So we're able to go into our clients' EHR and or risks and pull clinical documentation and provide that as well. So they are in most cases are able to completely outsource prior authorization, with the exception of maybe having some folks still on board to handle peer-to-peer reviews and maybe some additional clinical support, things like that. But typically, yes, you can outsource your prior authorization. You will see generally about a 70 and sometimes a 90% reduction in FTE headcount around prior authorizations. That's a good question there. Thank you, Jim. So our augmented intelligence, as we say, we are able to automate a lot of the non-essential tasks. We reduce the amount of time spent just sitting on phone on hold because we have bots that are essentially handling some of those tasks. And I'll explain how we do that here in just a moment. But we're able to be more predictive on outcomes when it comes to prior authorizations. For instance, here in our next release, we're going to have our turnaround time estimator. So if we know that we have a patient, they're coming in for a particular procedure on a particular day in a particular region, we break this out by payer, we'll be able to determine what the turnaround time for that prior authorization might be. And that allows you to be more proactive in your scheduling. If we know it's going to take, say, 2.5 days to get the prior auth turned around for a particular procedure, then we know we can schedule that patient out 3 days and be very comfortable that we'll have that prior auth done and that patient seen. So gives you more accuracy in your scheduling and the ability to keep those schedules more full. Okay. close that. All right. So here's our prior auth or patient access system, intelligent patient access system. We call it IPA or IPA plus when we include the verification on the front end. And this is typically where we get some questions. And I might throw some questions out to each of you to kind of think about internally. And if you have additional questions, please go ahead and type those out. But you see on the left-hand side of the screen, this is how we connect either through API, through HL7 or FHIR. For those of you on Epic, we are on the Epic Orchard platform. We connect with about 35 different platforms, including RIS, including EHR, again, order entry systems on the front end, and others. So any of the top EHRs you can be assured that we've already written interfaces with and are comfortable doing so. But we do connect either through API, HL7, or FHIR interfaces for those. So the data would flow into us, and we just need one feed for those if we do a bidirectional interface. We also allow for a bulk upload or a manual data entry on those. But typically with the larger organizations, if you're doing more than, say, a couple of hundred prior auths a month, we would recommend doing a bidirectional interface. It becomes more cost effective and throughput becomes quite a bit more efficient at that point. So we take one data feed, whether it's a bulk upload or an interface, both for the verification and the prior authorization. But the first thing that we're going to do is verify benefits and check eligibility. We're also going to provide for the patient pay estimation side. So that's step one. Now, if the patient is eligible for that procedure, then we'll go ahead and proceed with prior authorization. If they're not, then you have the discussion with the patient if they'd like to handle that out of pocket. So that's kind of the first step. So you see the second column there, determination. This is where artificial intelligence and machine learning really starts to shine. So in our determination side, we're determining whether or not a prior authorization is even required. And again, we leverage our AI for that. If no auth is required, then we're going to go ahead and report that back through our system. And also, if you have the bidirectional interface written, that'll flow right back into your EHR and or RIS platform. Okay. Now, if an auth is required, then we'll go ahead and submit those cases electronically. Again, we're connected to over 850 payers, including AIM and eviCore, and those. So typically, we are already connected electronically for those that do accept it. If there's no electronic submission capability available, then we have, again, our specialists that can run with it and make those submissions manually. And they'll also be available to complete any questionnaires or follow up on clinicals if we need to add those. So once we've determined that an author is required, then we're going to go ahead and initiate the case electronically. And you see all of the various components that would go into the prior auth submission, and I'll show you those here in the demo in just a moment. But once the case is initiated, we're really checking along the way to determine that we have the right member ID, the right MPI, that we have the right procedure. We're connected and partnered with Change Healthcare, so we're checking the member ID with the patient demographic, make sure we have everything in order there, and we have all the right information about the location, the physician, and so forth as well. Then on the back end, there are a number of things that can happen on the back end as far as follow-up goes. So the first thing is that could happen is an instant authorization. So if you get an instant authorization, you're getting the auth number, the expiration date, the effective date, and we're also going to give you a screenshot of that authorization. And all of that information would flow back immediately right back into your EHR and or RIS platform so that you can go ahead and get that patient scheduled with the instant authorization. Now, you might also have some payers that take a little extra time to deliberate over certain cases. If they do that, we actually have bots that are pinging those payer portals on regular intervals. And so we're checking for any change in case status. And any change in case status is reported back to us immediately. And we report that back into your EHR. For instance, if they come back asking for additional clinicals, or maybe we need to check benefits again, or you have a member ID that's wrong. Maybe someone entered it wrong on the front end, and we know that we need to go back and change those and keep those turnaround times down so we get those submitted correct first time. But as those bots are pinging those payer portals, if we don't get a response back in a timely manner, we have certain flags built in. So if we don't get a response back timely, our specialists will go ahead and pick up the phone and call that payer and make sure that we can get those auths pushed through, answer any questions that the payer might have, and so forth. Now, you might also have a result that comes back where they're asking for clinicals, like I mentioned, or for a peer-to-peer review. And in those cases, we will send either an email or a fax out to the relevant parties. We can also connect in some cases and get that response out to referring physicians if we have that information loaded into our system as well. Okay. So that's how our system works from one end to the other. I'll show you, touch real quickly on what this means for your organization, then we'll get into the demo here in just a moment. But again, it's very easy to integrate with our system. Our specialists, our tech side, product managers will actually handle the integration on our end, and then we would just rely on an engineer from either Epic or Cerner or eClinical or whomever to finish their side integration. Typically about a 6 to 8 week process, depending on how quickly the other side moves, but we are able to easily integrate with really any EHR or RIS system that's out there, including order entry systems too. So typically your approvals, your auths are going to improve your turnaround times. Again, most are handled within 24 to 48 hours. We do handle stat in same day cases, and we'll talk about those here in just a moment as we move through the demo. We're going to also automate your workflow. I'll show you some ways that our clients leverage our system to be able to more easily address peer-to-peer and clinicals and things like that. The whole idea is that we want to balance not only our specialists with our technology, but also with your team. So if you have a team of folks that you want to retain certain parts of the process, we can do that. You just let us know what makes the most sense for your workflow and your needs within your organization. So we kind of marry the three together, your folks, our folks, and our technologies. So if you want us to take it over 100%, we're able to provide 100% coverage of all your prior auth book of business. If you want us to combine with your folks and you want us to handle half of it, we can handle half of it. Just let us know how we can best support you. Again, our specialists trained within each medical specialty so that our folks, again, are talking to these payers on a daily basis and know some of them on a first name basis. We currently process about 3.5 million prior authorizations annually. So we know the payers pretty intimately at this point. And then on the back end, full transparency. We've got real-time analytics and reporting mechanisms that I'll show you here in just a minute. And you'll be able to track how well we're performing on your behalf down to the patient. Okay. So we'll go ahead and jump into the demo. And as I'm moving into this, if you have any questions, go ahead and fire away, pop those into the chat box there, and we'll get those addressed. Just log back in here. So everything we do is a SaaS model, cloud-based technology. And this is what you see when you first log into our system. Again, if we have a bidirectional interface, all the results and everything will flow right back into your EHR or RIS platform. But we do have some of our clients that want to leverage some of our tools in a workflow environment. Here we have the insurance verification benefits eligibility. If you choose to use this on the front end, maybe to discuss patient pay, there are multiple ways to be able to look at this data. But first you see the appointment number, the patient name, date of birth, date of service, the facility, insurance, and then there's a progress column here with a progress bar. You see in progress, action required, or finalized, or case canceled. So in the verification benefits eligibility world, maybe we want to just select all of those that are eligible and review those. And we could take maybe this first patient, Christopher Lewis, and this is what you see when you select the patient. You see the case summary at the very top. You see that they're, for this particular imaging procedure, that they're eligible. And then at the bottom, the CPT code, the allowed amount, the estimated patient pay amount, the payer, and then the payer due amount. So here's your patient estimation of $100. And again, we combine our information with that from Change Healthcare. We load in your contractuals to give a very accurate representation of what this patient pay estimation is going to be. Provided that patient hasn't been seen within the last 24 or 48 hours and the payer portal's not been updated, then this is going to be as accurate as you could possibly get. You then will go up here to your benefit level details. Your scheduler can quickly see the order details up top, subscriber details here. Then you have the plan details for this particular service. It'll be for MRI or CT. And then the plan information, it also includes the eligibility date and the plan end date. And that's important because you don't want to be performing procedures that you're not going to be paid on because the plan ended. Then you also have all the benefit level information, the co-insurances, the copay, copay, the out-of-pocket information, the out-of-pocket max, all of the patient's insurance information here. Also the deductible down at the bottom. Now, what makes this nice is you can have a real meaningful discussion with the patient on how they'd like to take care of their particular side of the charges. You can print this out for the patient by clicking the blue button to the top right, hand that to the patient so they can also follow up with their insurance company as well. Okay. Now I'll go ahead and move into the prior authorization side. Again, I mentioned that we just need one data feed to come in either from your EHR or your RIS or your order entry system. And we are partnered with some of the order entry systems like ScriptSender, Open Doctor, and some others. But if you're not leveraging that, no problem. We can just connect with, again, your RIS or EHR. And I'll show you the information that would actually flow into our system out of your EHR or RIS. First of all, you see the ordering physician information up top with the physician MPI. And again, all these fields will be auto-populated in either a bulk upload or a interface world. The patient demographic here, the data service information. Now we can also provide multiple visit authorizations for physical therapy, for oncology, cardiology, and things like that that may require multiple visits. So we can auth maybe 6 visits if the patient needs for physical therapy. So we can provide a data service start and end date. We'll have the place of service, the facility, if you have multiple facilities that would come across. If there's an admit in most orthopedic groups, there would not be an admit, but you do have a patient class as well. facility MPI, and then priority. And priority is important, especially if you're doing some imaging for the patient. If you have a stat or a same day case that needs to happen, again, our normal turnaround time is 24, 48 hours. Stats, we guarantee initiation within 30 minutes and same day within 4 hours. So we can get those turned around very quickly if you need those done. And we do retro authorizations where the payer allows. The insurances, they'll come through in the order that they're put into the system. If you have an EHR and you have the primary payer, then that will come across as the primary to us as well. We can take up to 4 of them. Insurance name, group number, member ID, all of that would come across. The CPT, you can add as many CPTs as you want. But that with the description modifiers would come across as well. The diagnosis codes, clinicals in many cases will go ahead and push across to us from the EHR. There are some where they have to be added on the back end, but we can certainly support that. Our specialists are trained to be able to go into various EHRs and pull the relevant clinicals on your behalf and submit those. If you want to retain staff to pull clinicals, then they would simply add them right into the case here. Hit create case and off they go. So very, very easy process as we move through the system. So I'll go back to the list view now, and different ways that our clients will leverage this particular view as a workflow tool. Again, maybe you have staff that you want to just check those that are pending information or working peer-to-peer reviews. We do have clients that want to maintain that level of service from their side. So you see that all these will say action required, little exclamation point. But if you click on the patient, you can see for this patient, procedure is 24310, there's no auth required. But for procedure 24006, pending information, you'll have some case level comments down here. Clinical notes are required. So if your folks are pulling clinicals, then they would just simply hit edit case, scroll down to the bottom, and keep in mind that you can edit. If you need to add another insurance, you can do that by clicking the button here, or adding additional procedures, you can do that by clicking add another procedure. Same thing with diagnosis codes, you can add case level comments. But if we're just adding clinicals, if they haven't been pushed across already, they just click the paperclip and add the clinicals, hit update case, and move on to the next one. Again, that can be handled either by your folks or ours. Okay. And you'll have multiple views. Go ahead and select all of these again so you have a clear view of what's going on. All the various progresses, in progress, action required, finalized, and the various statuses. If you want to select a particular facility to work through, you can do that. An insurance or data service. Also, if you have multiple departments, for those of you that may be in a hospital environment, we do have ways of making changes to this look and feel, and adding a department level drop down if we need to do that. You can also search by case ID, appointment or a session, or patient name. So you can search multiple ways. You can also look at the cases that have been completed, what's in draft status. For instance, if you have cases that you know you're going to need clinicals, but you haven't received them from a referring physician yet, you can just park them in a draft status or a pending status, and then come back and add clinicals, edit the draft just like I showed you a moment ago, and hit complete, and off they go. They submit automatically from there. Okay. So that's our prior authorization and insurance verification, benefits eligibility, patient pay estimation, look and feel. The gentleman that developed this out, you may have seen him speak at one of the association meetings. His name is Navaneeth Nair. He spent 10 years with two of the top 5 payers and developing out their adjudication engines, artificial intelligence, machine learning, things like that. So he has a wealth of knowledge in how to connect our system with their system and what it is that the payers are actually looking for. So he really is looking as deep as possible on how to reduce denials and how to get these processes as streamlined as possible. He also spent 5 or 6 years with IBM Watson, so he just has a huge brain on him. We're lucky to have him. Now, we'll go ahead and show you what our the transparency side or our KPI, our dashboard and reporting mechanism here on the back end. So we do have full visibility into everything that we do. Our clients really appreciate this, not only from the business intelligence side, but when they pick up the phone, they can have a meaningful conversation with us. If there are any type of anomalies that they see in any of these dashboards or reports, we know we can address these issues quickly. So all this data is updated in pseudo real-time environment, meaning about every 5 minutes. So what you see here at the top, you see the number of cases that have been sent by day, the case turnaround times here on average by day. And here it looks like we have some anomalies on the 20th, 21st. So we know we might want to drill into those and find out what happened on those 2 days. Possibly some of the payers may have changed some of their rules. Payer portal could have been down. Could have been that we have some more complex procedures on those couple of days. So, but we know we can drill in and find out what's going on those days in particular. We have the number of cases that are finalized. Looks like our volumes were much higher on the 21st. You see the CPT, the top exams by CPT code here on the right. The top payers. And then the top facilities broken out by the volumes. You see the auth percentages, and if there are any denials. And we see the percent of retro authorizations, then percent no auth required. And if you want to look into this in more detail, you can select the graph from the left-hand side, like case turnaround time. And you can look at that day over day, week, or by month. Or you can put in a date range if you want to look at it by a particular date range. So that's our real-time, our pseudo real-time reporting. The last thing I want to show you is our report builder. And we have just about all the parameters you can possibly imagine here to run reports by. You can run by case number, by patient name, date of birth, gender, by physician group, data service. You can run by insurance or insurance group. You can look by procedure, by specialty, by modality. For those, if you're doing some imaging, if you want to look at it that way. By case type, product type, by job and case status, which are probably the most important of the parameters here. So I'll go ahead and leave all of these selected. You can look at it by the last 7 days, the last 30, or put in a date range again. We'll just look at it by the last 7 days, hit save and proceed. And you see all of the patient headers at the top, the physician information, the location, the specialty, and in this case, you see a lot of radiology. Who created the case, when, if it was modified, so we're time stamping everything so we can track it. The date the case, if it was finalized, you see data service, the actual procedure, the modality if there is one, the insurance ID, diagnosis information, case status, these are in progress. And for those that may have a completed authorization, just scroll down, you'll see these are finalized and approved. You see the auth number, effective date, the expiration date. These are prior authorizations. And then you'll also see the turnaround times at the very end. So you'll see that these took about a day to complete. These are in hours here. So 24.73 hours for these auths. Okay. So that's our system overall. Clearly more happens on the back end. There's a lot of magic that happens behind the scenes. But we'll kind of conclude our live demo of the system, and I'll kind of open the floor for any questions that might be out there.